Hi, my name is Korey with Align Therapy. Today we're talking about SI joint pain. It's a common complaint we have here in the clinic, and I wanted to today go over a few exercises that you can start doing if you're having SI joint pain. Before we get into the exercises, I wanted to talk about the use and benefit of an SI belt. An SI belt is designed to go around your pelvis, like so, and the benefits of using this is to give you some relief while you're working on increasing your strength and stability of the muscles in the core and hip. A frequent question I get is if this is going to rob you of any strengthening, and the answer is no, as long as you're working on putting in the effort to strengthen your body. Use this when you're doing these exercises if they cause pain, and see if they decrease it so you can get the work done to get the relief that you're after in the long term. So I'll wear this while we're doing the exercises. The first two can be done on the floor or on your mattress or whatever. The first one is a single leg bridge with hip abduction. And it looks like this. You're going to bridge up, and then you're going to bring that leg out to the side, just like that. What I'm focusing on is not allowing my left hip, the leg that's up, to tilt down towards the table as that leg goes out. Really feel that activation in my hip and along my core as I'm not allowing it to drop. Something else that I'm keeping in mind is that this planted leg also stays still. It doesn't want to come out when I push out like this. If you allow it to go out like that, this side isn't doing the best job it can with stabilizing, which is the whole goal with SI joint problems, is we need more stability. So let's see if I can do an okay job of doing that. But that's what I'm concentrating on. And you'll do that 10 times, do that 3 sets, 2 to 3 sets, depending on how irritable things are. The second exercise is a bridge, just a regular double leg bridge, just like this. And you're going to hold. What I recommend doing is getting a really strong banded loop to put around your knees so that you can get some activation of your hips as you're holding this. It needs to be strong. Work on activating your core, glutes, and glute med on the outside. You're going to hold that for 10 to 15 seconds and then relax and then go right back into it. Okay, again, it's all about stability, being able to hold a position, getting good coordination of all of the muscles that stabilize the pelvis. The last exercise is called Captain Morgan. Take a ball or a towel. You're going to place it on the wall at the level of the knee. And the action is this. You're just going to push this leg, this knee, into the ball. And you're going to feel a lot of activation of the muscles on this left side of the hip and through your core. What I want you to focus on is not leaning into this. Because if I push, maybe I want to come out this way or this way. The goal is to maintain your body in a straight position, just like if you were standing on one leg as you push. Push as hard as you can still control this position. 10-second hold. You'll relax. Do that 6 times, both sides. If you work on these, I'm already out of breath. If you work on these consistently, if you do these 3 times a week with a day of rest in between, 2 to 3 weeks, give that a shot and see if your symptoms aren't improved. Thanks.